Hey guys, Dr. Todd Lloyd here, coming at you with another episode of Chiropractic Crack and Coffee. I gotta get my coffee cup. So I've got my coffee cup, I've got some chiropractic videos to watch, and I'm a chiropractor. We're gonna watch some cracking today. And today I thought I would choose a video by a chiropractor I admire because I've learned some stuff from him in the past. And the purpose of this channel is educational. So I'm a chiropractor with 18 years experience. I practice out of San Francisco, California. I'm in my home studio in Sonoma, California. And today I am going to watch chiropractic videos on YouTube as part of my own continuing education because I always learn something either to do or something to not do. Today I'm going to watch Nelson Vitanze, who is a chiropractor, Colorado, Vetanze. I have watched his stuff in the past. I've learned some moves to use, and I'm hoping I can see him use the same moves today in this video. This video is a little bit older. This one was done in 2013, so about 7 years ago. What I learned from him in the past was this foot move where he took a speeder board that has a drop mechanism, and he used that to adjust an athlete's foot to improve the biomechanics of the feet. And ever since I saw him do that, I added that to my toolbox for when I'm working on my own athletes. So let's see what Nelson has to say here.
He was quarterback for Kansas State, third in the Heisman Trophy. So now other people are hitting those YouTubes. Oh, call the client. We're going to watch it now again.
Apparently, he works on a lot of athletes in this area in Colorado.
3 or 4 months ago, you were having some problems, and his agent said, you go see Dr. V and kind of tell us what you were having.
Well, basically, I think I just had a little bit of carryover from the season, and especially like my neck would click and pop when I turn to the left, like every single time.
Oh,
and
that's not good.
I've been to some chiropractors before, and never really felt right afterwards. And I came to Dr. V, like you said, my agent recommended him, and
Dr. Vitanze's
he started from the bottom
technique.
up. He started with my feet,
Yeah, I
went
wonder
to
if
my
he's got
knees,
something
fixed
special
my
stored
hips, worked out my low back.
I like
a
how
little
he's got
bit. And then when he adjusted my neck, it stuck, and
a hip model,
the very first time I
neck
walked
model.
out of the office, and for the first
There's like
time
a hand model there.
in a long time, I was able
He's
to
very
actually
much
turn
into
my head
education for his patients. He's got
football's a brutal game, and so
his X-ray light boxes with the DK posters demonstrating what you might see on an X-ray if you've got these conditions. He's got a whiplash poster, which is a little bit old school.
Let me ask you a question.
I don't like the
when I
subluxation
adjusted
degeneration poster as much.
You're working with Jake Plummer now, okay? And what Jake said is, when you start having your adjustments, you had like 2 or 3 or 4 something in a row or scheduled, and he says he could just see your form, your arm go higher and higher, and better and better. Less pressure on your shoulders, smoother delivery. Can you comment on that? Is that true?
Well, I think it was a little bit of just, your approach is starting from the bottom up and making my feet and my hips and work in conjunction with
So I like the way Dr. Vitanze will reinforce the benefits of chiropractic care, especially in regards to the patient's needs.
I think the foundation
so he puts it in relatable terms, like
put together.
The coach could see really more and more range of motion.
Well, let me ask you this question: you were doing all these workouts with Lauren Landau, who's one of the greatest sports trainers probably in the country today. Yeah, and you're doing all these workouts, and you're out of alignment. You know how I feel about that.
I do, and it doesn't feel right, and you don't really even know it until you're right, and then you can feel it.
What I don't feel good about is that.
So he's out of alignment. The leg was about an inch and a half, 2 inches short. Pelvis was twisted.
Stuff for a chiropractic office.
He's doing all these exercises to build strength.
Framed.
In other words, he's taking a bad golf swing or a baseball swing or throw and making it worse because he's practicing over and over and over and over that bad pattern. And so I said, Cullen, no good. And all you players, whether you're a pitcher a quarterback, a wide receiver. We
Dr.
take
V
care of
is
all of them.
reinforcing
A
the
kicker,
importance of having
punter,
good biomechanics and good
especially.
symmetry in the body
If you're
for
out of
sports
alignment,
performance or
you
for
go
general
exercise and run and do
musculoskeletal
all
health.
these exercises to strengthen everything. Understand something. Structural misalignment. Here's a bone, here's a bone. There's a muscle between the bones. You go out of alignment. This bone shifts here, this bone shifts here. You got the same muscle, but now instead of it being this way, the muscle is this way. Now say that's the right side. You go to the left side where the muscle was supposed to be this long.
That's a good
Now
point,
it's
but I
this
think we
long
need to move
because the
this along
shortened
because this
side
video
over
is
here,
24
the
minutes
right
long.
side and the left side work
So let's find out when he actually starts
antagonistically.
working on him.
So when you change the points of
6 minutes in. Ceremoniously adjust the table for the patient.
so we go here. You got eighth and inch shortness of the right leg.
We'll show him the right leg. He'll probably
This
have
used
some
to be
hip
2 inches
misalignment
short.
now.
I'm very pleased because it held. Healthy, young, and strong. He hasn't had enough serious injuries or structural damage or ligamentous soft tissue damage that would cause this to be permanent, so he responded very beautifully. Bend your knee.
Well, there's shift in the pelvis there.
Bend your knee.
Kind of locked up on one
Symmetrical
side.
but tight in the quads, correct?
Mm-hmm.
So this does nothing to do, in my opinion right now, because he's
And look
balanced.
at this old poster, the human
Although
spine.
we'll adjust him and see what happens. I just
It's like
believe he has
yellow
tight
from the
quads.
years.
So with active or passive
Unless it
stretching,
came that way.
I have Robert Tanabe here who does athletic specialty work with passive stretching. He'd work on the quads, getting some deep tissue massage in the quads, using the Simulcare right over the quads to put blood in the quads, okay? Because you don't want overbalance of muscles, too much quad, not enough hammies. You don't want too much hammies, not enough quads. You don't want too much gastroc, not enough anterior tibialis. It's got to be a certain percentage, 10 to 1 or whatever it is, okay?
Does he
Because
train like an
if you
athlete?
overpower the antagonistic muscle, you're going to tear something. Shin splints, you're going to tear
Interesting if he did.
a hamstring muscle, a groin. Okay, so let's check his pelvis. Yeah, you're a little flat on the right, but not bad, okay?
Hands
So much
right
better.
on the ass.
Ischium, a little high on the left, tailbone, little high. I'm proud of you, man. So much different, huh?
That's a great table.
Now let's palpate the spine.
I like how it elevates.
Is that the testotas? That's a Fiesta Bowl you played in, right?
Yes, sir.
Oh, that's funny. I didn't get a Fiesta Bowl shirt. You know? I'm just kidding. All right, let's roll, rock and roll. Movement palpation. Rock the pelvis. Check every vertebra.
That's a different kind
Now, I
of
notice
technique.
when I get right here, I feel a little high rib cage, and I feel a little flat rib cage. Understand, he's a right-handed thrower, am I right?
Yes.
So he's torquing constantly this way. So he's starting to develop just a little bit of a pattern here. Understand the baseball pitcher and the quarterback
That's
are going to
good
have a
perception,
larger right
actually.
throwing side than a non-throwing side. So what you have to do, what I do, is tell them to do. Throw
Opposite.
opposite. If you're going to throw
good
100
brain
times here,
development, too, the
throw
throw
40
with the
times with the other
non-dominant
side.
arm.
Just to let it know you still love it and get it firing. Because you're going to, again, over-dominate. The percentage of this will be too great on the antagonistic muscle.
That's good to fire the mirror neurons by throwing the non-dominant arm. But he's approaching this from a structural position where he's going to balance out the muscles from one side to another by having him throw with the non-dominant arm.
All work symmetrically, and you're going to have an injury. Golfers, too. You're a right-handed golfer, you hit 300 strokes right-handed, shoot 30 strokes, 50 strokes left-handed. You don't have to hit the ball, just go through the motion. Balance out your spine, man. You're torquing. I've been doing
And
this
your
for
brain.
42 years, so I bend over, my back is shot. I wasn't smart enough 35 years ago to work on this side of the table and this side of the table and bend this way. I don't even know how to bend this way. So now when I go home, I lay and I bend and I stretch to balance myself
top
out
tip
to
for you
67
young
years old.
chiropractors out there.
I want him to do it now before he gets my age and he's all busted up. And football players, NFL, as you read, get busted up very badly, immensely bad. And I try to prevent that. We've had thousands of NFL players come through here. Many of them are retired right now. They still come from all over the country to get treatment, nutritional treatment, stretching treatment.
Dr. V
They all
can
have
really
simulcares
pontificate.
where they use
He's
at
got the
home,
long
treat their
pause when
condition.
he speaks.
Okay, we
He
treat them
doesn't
constantly. We
ah.
talk to them all the time, send them whatever they need, and make sure they're doing well. So let's
I
just
think he
clear you
figured
up
out early on
right
that
here.
with a little pregnant pause.
And a
talking
little
to
bit
somebody
first
that they're-
cervical.
they're
This
gonna,
is right there, the
lean
first
in
cervical.
and
That's
really
the
listen
key.
to what he's saying.
All right, let's go back to the feet.
So this guy came in with a neck sort of instability where he turns his
Right
neck.
foot, flexing good.
He experiences
Left
a
foot.
popping noise.
I like it, man. You feel equal
Dr. V is
flex?
starting from the bottom up because
Yeah.
he does some kind of a gravitational technique.
Toes are a little tight. Do the toes.
Popping the toes.
Now, Colin, is it safe to say that you're an active quarterback like the Kaepernick from San Francisco? Safe to say that? He can make things happen. He's a game changer. He don't stay in the pocket. He's fast. He's strong. He's big. He runs. He throws on a run. He throws in the pocket. Tremendous athlete. Obviously.
Checking dorsiflexion to the
Well, you
foot
got a
and
little
ankle.
click in your left ankle. You feel that? You feel that coming from here?
Yes.
Dr.
Does
V
this
is
stop
showing
it?
him the functional deficit
Yes,
as well as
okay.
testing it.
He got
And
a
I
click
can
in
kinda
his
see that
ankle.
he's
I thought
using
maybe
his
it was
powers of
lateral
perception to feel
retinaculum
it.
on the left.
That's why
but
he
it's
does
not.
it over and over.
What I did is I contacted the retinaculum, still clicks, I bring it back posterior. Wait a minute. No, it is the retinaculum. Is that tender there?
No.
Okay. You sprained your ankle? Not recently.
Not recently.
Okay, and
Nice to
this
see the
is
problem
your
solving going
this
on
is your plant
here.
foot.
Yes.
All right. Can you hear that click on the camera? Huh? Yeah. Click. Okay, so when I flex him, this tendon coming here and shooting up, okay, lateral tendon is held in by a lateral retinaculum, and it's right there. Now, should I treat the retinaculum or should I try to adjust this foot first to change the position of the bones to see if I can stop this clicking? You don't want this tendon clicking over that bone. That retinaculum has to hold that in place so this tendon don't click. You don't want that. So we have to figure out what's going on.
Yeah.
I think I know, but
I
let
really
me
want to see if he can make that clicking stop here.
That stops it, right? So when I push the tendon, lateral tendon, posterior to anterior, it stops. So let me move on your back for me. Let me position the talus bone.
All right, here comes the talus adjustment.
I don't want this light to end up on me here, Jerry. So,
What?
you have it? Come on. There we go.
What was that?
I want to adjust the talus down. You don't want this.
Let's take a look at that again.
I want to adjust the talus down, hold the calcaneus, you put it vertical, and you get the talus to jump into place. All right? And you adjust the fifth metatarsal, face down.
I missed it again. Hold on. Let's go back. He's prone, he's prone, he's prone. Now he's supine. Let's do this.
I don't want this light to end up on me here, Jerry. So, you have it? Come on.
Do it again.
There we go. I want to adjust the talus down, hold the calcaneus, you put it vertical, and you get the talus to jump into place. All right?
Toe was in the fifth metatarsal again. That calcaneus,
adjust
that
the fifth
talus adjustment, that's
metatarsal.
different than
Face down.
what I've seen. Let's see if the clicking went away.
Now, I don't hear the click anymore, but I feel it making a little noise. See, this tendon is in a sheath, And this tendon's trying to pop out that sheath, so I'm not going to let it happen. Now let me ask you something. Is that tender there at all?
A little bit, yeah.
No, okay, how about here? Any difference?
No.
No, it's about the same, right? And the tendon is tauter over here. So let me go to the low back, fix that structure. You're surprising me, man.
So he's checking the talus motion, that dorsiflexion in the ankle when he's face down. I always do that face up. But I can see how that works for his technique because it goes from the ground up, he goes right to the pelvis. He's using SOT blocks with a drop.
Excellent.
So he doesn't have to spend time or, I guess, the energy to put him in side posture
One more time.
to adjust his low back.
So I'm going to correct the pelvis.
All right, now he's doing...
Change the position of the hip, which then changes the rotation of the femur. Then I'll come down here.
Hip,
and
femur,
it's
knee.
this one, right? Is that the knee was? Yeah. Okay, so, here's your tibial tuberosity.
Yeah.
Now, he's not having any pain much. Yeah, no pain. I mean, you're doing good, right?
I check for this knee rotation
But
every time.
I'm finding stuff that's going to be painful. Here's the patella, tibial tuberosity. In the middle. Can't have that. Tibial tuberosity. Outer third. So there's a little something going on from here to here and here. The tibial tuberosity here must be on the outer third. Okay, that's
It's
the proper
rotated in.
place it's supposed to be to prevent knee injuries, and that's where it wants to be. So,
What's he going to do?
I rotate the leg out. You hear the click? The click was me rotating the tibia, gapping it, and forcing it anterior and lateral.
Wow.
So now let's come back. Here's the tibial tuberosity. It was here, it moved here.
Right back in place.
It moved about 3/8 of an inch. Okay?
Nice.
This is important because
That's gonna
this
make a
is going to
difference.
cause a problem.
That'll make a big
Everybody. Doc, how do I know? Straighten your knees out, put your fingers on your patella, check this big bone right here, tibial tuberosity. It's got to be on the outer third of your patella, period. If it's inside your patella or rotated immediately, it's a problem.
So apparently it happens
If
a lot
it's
where it
rotated
rotates
this way,
inward.
do you have to have pain here? No, you could have pain over here. Why? You're favoring this one, throwing all the pressure over here. Okay? So he's not having pain any place, but he will on your back. Face down. So you had a feeling to come in today. Now you know why, huh?
Yeah, I do.
Those are great cargo shorts. They're cargo shorts,
So right now,
plus they're plaid.
there's no more clicking. I feel a little crunchy because I think it's a little inflamed in here. That'll go away in a day or so. But now, a little bit. It's off and on. There's still a little bit happening there, but it's much improved. It'll get better tomorrow. Before he goes back to Houston, I hope you're going to see you one more time or not.
Hopefully.
Yeah.
All right, here's the
When you going back?
Tomorrow or Saturday.
Oh,
Up on this leg.
yeah, man. I'm not going to see
Yeah,
you.
I learned that from him.
Just on TV, right?
Navicular.
Let's get the calcaneus.
Yep, I can do this one too. I learned that from him.
Bend your knee.
Better.
Well, that's not possible, is it? Bend your knee.
Still locked up.
Okay, the first time
That's
we
still
did
tight.
the knee flexion, correct me if I'm wrong,
That's
we
better.
stopped here. Now we have here. By correcting the pelvis and the sacrum, it absolutely took pressure and relaxed and increased the range of motion and flexion and releases quads. Bend this one. Bend this one. Excellent.
I'm not
I
having
like
Nelson.
that.
That's still locked
See,
up on the
because that
right.
makes him more balanced now. He was way too tight in his quads. So now his quads will be flexible. He
Maybe the
won't get a
camera's
burner there or a
kind of
quad pull
throwing it
or a
off.
groin injury. That was just an extra benefit, surprise benefit. Good for us. Let's go up the spine. Movement palpation.
Crunch it.
Very good. Still got that left atlas. That's probably from getting banged a couple times, huh? Lay on your side, face me.
Once or twice.
Yeah, once or twice.
I was going to toggle him.
All right. Drop this off. Straighten out your bottom leg.
No.
Bottom leg's always straight. Okay? I hook my knee.
Low back.
Just stretch him. Just stretch him.
Okay. It's just a stretch.
Chiropractors, protect yourself with this adjustment. This is a hard adjustment on you.
Yeah.
On your knees, your hips, your feet, and your low back and your shoulder. All right? Okay, relax. Bingo.
Huh?
About 3 vertebrae. Nice. We got the movement. Big deal. It's a mobilization. He needed it. Feels good, didn't it? All right, let's
That's
do
why
your
we do
other side.
chiropractic crack and coffee for cracks like that. I like that one. A little bit non-specific though, but
Just relax him. Just stretch it. He'll tell you. You hold their shoulders back. Do it easy. You're not going to hurt their shoulders. Just do it easy. If they already have a shoulder problem, they're not going to let you do it. You might have to go up higher, or you might have to go into the chest. But just get into the gap here of the shoulder and the axilla, just gently, and there you go. No problem, right?
Nope.
On your back. You'll feel their body
Dr.
relax,
V is a
and then you
seasoned pro. You
just
can
give a
see his
little
approach
adjustment.
there.
So we'll go up
Casual.
here. Clavicles, even. You got a little anterior on the left. Yeah, let's do one thing. First things first. Come on up for me. Sit with your back to me. Yeah, second rib. It should feel like this. It doesn't. Yeah, okay.
Yeah, that's why
Here we
he
go
cracks
again.
when he moves his neck.
Lower back out of alignment, knee, foot, and he's a quarterback. So, high left sternoclavicular joint, low right sternoclavicular joint.
Quarterback guy's all business
Here,
too, man.
he has a low left
not wanna joke around.
scapula. So you have high clavicle, low scapula, compensatory.
Why is he so
Now remember,
serious?
I already fixed everything here. So now up the chain of correction, this should be easy to fix. Sit in the middle of the table. If I try to fix this second rib without fixing anything below it, the compensating pattern hasn't opened up to allow me to do that chain of events adjustment. Now that I did, this is just going to it just jumps right in. If I don't do that first, just go slam away at him, he can say,
So he's all being cavalier and casual about it. Oh, by the way, I'm going to adjust you right here. So it looks like he used the drop piece on the table just to kind of slam down that first rib.
the compensating pattern
Let's watch that again.
hasn't
A little
opened
sleight
up
of
to
hand.
allow me to do that chain of events adjustment. Now that I did, this is just going to it just jumps right in.
It just jumps right in.
If I don't do that first, just go slam away at him, he can say, Doc, what the hell? This is just going to it just jumps right in. Now that I did this of events adjustment.
One more time.
Now that I did, this is just going to it just jumps right in.
The whole body.
If I don't do that
drops
first,
down.
just go slam away at him, he can say, Doc, what the hell are you doing to me, man? I'm hurt. That hurts. And it won't fix it.
Doesn't look
It'll
like very
bruise it.
happy
Okay,
right
now
now,
let's do
though.
this.
It's kind of like an NPC.
Freaks you out, doesn't it?
Finally smiled.
Nothing. There's nothing. I felt, see, the first 4 ribs are bucket handle. When you take a deep breath, the ribs come up. Runners, sprinters. If your first 4 ribs are out of alignment or fixated, you're not breathing. Your lungs can't get up. And so, since it's a bucket handle, it's easy to fix. You lean left, tap it, tap the table and the knee at the same time. Boom, tap it in place, boom, it's there. No more pain, right? All right.
Wow, that's a different
Good,
kind of
perfect
technique,
alignment.
too.
Perfect alignment. Now on your back.
That will make
Now
the
it's
neck
the
easier
easy
to
part.
move.
Isn't this fun, man?
Yeah, blast.
Okay, relax. Get the first cervical on the right, left. Come back. Second cervical here on the right. Come on, come
Using
on,
his
come on, come on.
Palm?
Did I take x-rays? No. Am I trying to change all his curves and having brand new cervical spine with a lordotic curve? No. Am I using my hands to feel and diagnose objectively and feeling everything in his spine?
Yes.
Yes. If he develops something that I feel is acute or a necessity or a complication, whatever that may be, that requires an MRI or an x-ray, then I'll send him. I think x-rays are overdone. There are radiation, potentially poison. They got to be done correctly. Are they bad? No. Are drugs bad? No. Saved my life. When I had my hip, drugs are great. Used properly. Use it every day, make it a routine. You live on them? Wrong. It's not intended for that. So any therapy we use, whether it be surgery or drugs
the necessity
or any
of
of these
drugs
things,
and x-rays.
nutrition, It's just got to be done in when and how.
That
the right
draws
way.
out his appointment
It's
time,
not
so
that
there's
it's
like a
bad.
half-hour
Are
long
there
now.
chiropractors that don't do what I do, are they bad? No, they just do things
I'd like to
differently.
see him do a regular
But
encounter,
if they don't
day-to-day
do
stuff without the
everything,
camera rolling, where he
then
feels
they're
like he
not,
needs
in my
to
opinion, doing
educate
the best they can do
all of
to
YouTube.
get the quickest, most lasting results. I take care of premier elite athletes that have to perform for 40 years. This is what I developed to make these guys the best they can be. And at some point, I hope to get millions. But it hasn't happened yet. Come on up.
What else, Dr. V?
Yeah, I mean, if I figured they'd leave me in their will or something sometime, leave me a couple $1 million, right? All right.
What's he doing?
Little open up your tentorium cerebelli by doing a little ear adjustment. I love you, son. You're good.
Hey, thank you.
You're
All right, guys, that was another episode of Chiropractic Crack and Coffee. I really admire Dr. V. Learned a lot from him last time I watched him, and I learned a couple things this time too. I like his approach. Underrated. Other YouTube chiropractors get millions of views, but Dr. V does not. But maybe it's more like that he's the chiropractor's chiropractor, and it's more for the cerebral of us trying to hone in our chiropractic game. But he's got a good approach. He's got a good philosophy towards restoring movement, restoring symmetry, testing and retesting. I suppose he could do some more muscle check testing, retesting like some other chiropractors do. But now he gets his results. He's a little bit arrogant about treating his athletes. Don't like that, but I like how he demonstrates the correction, fixes it, leaves it be. So, bravo, Dr. V. That concludes another episode of Chiropractic Crack and Coffee. Educational purposes only. We're reviewing these videos for the purpose of critique, education, and I'll link the URL for the video below. Thanks for watching.